Welcome, everyone. We are here with Amy Mendillo, author of I've Just Seen a Face. Oops, got it in the blur. But this is another one of our author series that we have that will live on YouTube and social media for Watchback. And thank you, Amy, for taking out the time to join us today. And we are excited to hear more about your book.
Thank you so much for having me. I'm so excited to be here. It's a pleasure, Khadija.
Yeah, of course.
Yeah.
And I know that you had met us at ACPA, so I'm so glad that we've been able to kind of keep that connection going since
Yeah, it
then.
was really, really fun. It's so
Yeah.
fun to go to ACPA. There's so many people there. It's just like a big
Oh,
party.
yeah,
Yeah.
definitely. Awesome. Well, Amy, can you tell me a little bit more about yourself and your background and what kind of inspired you to write this book?
Yeah, sure. I will actually hold the book up so that it does not have the fuzz.
Yes.
This book is called I've Just Seen a Face, a practical and emotional guide for parents of children born with cleft lip and palate. Um, I was inspired to write this book because I saw a need for it personally. When my daughter was born, when she was diagnosed with cleft lip and palate, my husband and I learned about that diagnosis at a 20-week prenatal ultrasound. And at the time, we just looked for all the resources we could get our hands on. Um, and while we really felt confident in the information we received at the time, we received such good information from her Cleft team and from the ACPA and from other resources, friends of friends, people we knew who were familiar with the condition. We looked for and couldn't find a current all-in-one guidebook for parents of children born with
Mm,
clefts. So I was really motivated in part by that need that I felt personally and that need that I heard from so many other parents who I talked afterwards. Um, but I was also motivated by the emotional issues that can come up for parents during that very intensive first year, the prenatal period and the first year of a child's treatment. Issues that I experienced myself, questioned and heard from so many parents, questions about bonding, issues about appearance, um, questions about how to relate with family and friends, bringing a baby out in public, feelings of, in many cases, loss when a mother is unable to breastfeed, cannot breastfeed a baby born with cleft lip and palate or cleft palate because uh, the baby is physically unable to suckle. And feelings about surgery, feelings about the making changes to a baby's face. So those topics I found were so sensitive and really compelling and hadn't been written about. So it was really both that were inspiring.
yeah, no.
Yeah.
Honestly, thank you for writing the book, because I know you've put a lot into it, and there's
Yes.
very informative.
Oh,
Uh,
good. I hope so. I hope so.
and I think it's nice to come from a parent that's also kind of lived some of these experiences and now is kind of saying, "Hey, this is what I went through. This is what other parents have said. This is what other medical professionals have said." And this is kind of
Yeah,
like a one-stop spot to kind of get
right.
some background if you don't know where to start. Uh,
Yeah, exactly. And I really wanted to do it in a way that was clear and accurate, of course, but also accessible and friendly and sort of easy to read. The book does not have to be read start to finish. It's a big book.
yeah.
You can sort of pick and choose your way through and just make use of it that way.
Yeah, definitely. Can you kind of give us a little bit background on like how you have structured the book? I know you just
Sure.
spoke about how you can kind of like open it up and read a chapter not in order. So like how have you structured this?
Yeah. The book has several types of chapters. I offer sort of nuts and bolts type chapters with in-depth information about surgery, about recovery, about managing feeding, about anticipating the birth of the baby.
Mhm.
It is. I did not list that chronologically just now, but
Yeah.
the chapters are arranged chronologically by the age of the baby, starting before birth during the prenatal
Mhm.
period and then extending through the end of that first year. So detailed information on what to expect. Also, chapters that contain lots of tips and tricks, like for lack of a better word, hacks that I've learned from sort of gold nuggets from parents, from providers, how to deal with bottles, how to deal with pre-surgical infant orthopedic, sort of things to know at home. Um, I also have chapters devoted to honest discussions about some of those emotional issues that I mentioned. And I also have chapters interspersed, very short personal essays about my personal experience.
Mhm.
So this sort of covers the gamut with all those.
Yeah.
Um, but the research for all of it draws from in-depth interviews that I conducted over time, some of them repeated, with about 150 providers from all cleft disciplines and parents of cleft affected children. It also draws from hundreds of academic articles and printed materials from advocacy groups and the like. So there's a lot that goes into it. Yeah,
Yeah. It sounds like you did a lot of research and had to talk
I
through
did.
with, like, a lot of people. How long did this process take you?
Uh, Almost about 9 years. I started, my daughter's now 11, almost 12.
Huh.
And I started about a year after she was born because there was no
Oh
writing
my
a book
gosh.
during her first year because it was so crazy.
Yeah. In the beginning, was it more of you just kind of collecting information for yourself and then thinking, "Oh, we could turn this into a book?" Or was the idea always a book to start with?
Um, During her first year of life, it was that. It was collecting it
Yeah.
for my own purposes. But then something sort of clicked and I thought, okay, this really needs to, I really felt compelled. And so I started doing that research in earnest. I have a background in my first career was in classical music. I was a professional oboist, but I switched to public policy with an emphasis on health, and I've
Mhm.
since been um, a freelance writer with an emphasis on health and family and civic advocacy.
Yeah.
So, yeah,
Is there so I know that the book focuses more on, like, children that are born with cleft lip and palate.
yeah.
Um, is that would you say that is the main audience, or do you feel like other, I guess, parents that have children with facial differences could also benefit from some of the information?
It is focused on clefts,
Okay.
but I know that there are so many children born with syndromes that have clefts as part of that
Mhm.
syndrome. Um, and so the audience, I would say, is primarily parents of children born with cleft lip and palate, but also their loved ones. Um,
Mm.
in fact, there's a specific chapter dedicated just to the loved one. It's called "What Can I Say,"
Yeah.
um, with ideas for how to handle those relations.
Okay.
Yeah.
Is there anything else that you would like to kind of share about the book that I might not have asked yet?
Um, I guess just that I hope my goal with the book is to help parents feel empowered
Mhm.
by providing information, by providing lots of sample questions that they can ask to sort of become the best advocates they can be for their child, to feel um, really motivated to become team members themselves. That's something that the providers would say over and over again, that they considered parents part of the cleft team of all the
Mhm.
specialists, and parents are such an important element. And so I just hope to empower parents to have all the information they need to ask informed questions and to know that their honest responses are valid and that they're not alone, and it can really feel isolating. And so I just hope that people feel more reassured.
Yeah, no,
Yeah.
definitely. And I think I honestly, like, again, I know I said this already, but thank you for writing this book and, like, taking the time and effort to, like, put all of this together and with the goal to, like, empower those who read it to feel educated and feel like they can ask those kind of difficult questions.
Yeah, yeah. It was really my pleasure. It truly was a pleasure. I mean, I was starting from zero, and I was so pleasantly surprised by this community. I mean, I made cold calls, people who didn't have to call me back, much less call back and talk and offer so much information and honest stories from parents, and like really amazingly informative pieces of
Mm.
information from providers. So, yeah.
Would you mind reading us a portion of the book?
Sure, I would be happy to. In fact, the chapter I just mentioned, or the one for family and friends, this one,
Mhm.
it's chapter 17. It's called What to Say. I'll read just like the little introduction. It's called What to Say: Ideas for Family, Friends, and New Parents, a two-way street. When Jessa first shared the news of her infant son's cleft lip and palate with close family members, their reactions surprised her. Ordinarily, Jessa felt supported by her parents and other relatives when challenges arose. This time, unfortunately, some of their comments stung. My mom doesn't understand why my baby can't breastfeed, Jessa said. My grandfather refers to my baby's cleft as a hair lip, and my friend's mom has told me that I need to warn people before they meet the baby so they aren't caught off guard by her defect.
Mm.
If the remarks hadn't been so upsetting, she noted, the collection of statements would almost be laughable. I have handled these situations both well and not so well, she added. Interactions with friends and family can feel stressful for the parents of kids born with cleft lip and palate, as they did for Jessa. Some parents have strong and fresh feelings about the news of their child's condition that they haven't fully digested themselves, especially if they learn the diagnosis in the delivery room as opposed to via prenatal ultrasound weeks earlier. Some feel nervous simply anticipating the reactions of loved ones, realizing that the situation and the relationships can feel complicated. Yet here are friends and family standing in a hospital hallway, balloons in hand, waiting to meet the baby. While a new parent may easily wonder, what should I say to them? It is also true that 599 out of 600 of these friends and family were not born with cleft lip and palate. A loved one may easily enter the room considering the very same question, what can I say? This chapter is intended for both parties. If you are among the family, friends, coworkers, neighbors, or even medical staff in the delivery room who are waiting to meet the new baby, you may be wondering how to support a parent of a child born with CLP, cleft lip and palate. The first two sections of this chapter offer suggestions for sensitive communications and active listening. The third is intended for new parents because thoughtful communication, after all, is a two-way street. These messages and techniques are intended to help everyone involved, especially, if not until later on, the affected child.
Mm.
And then it goes on and it offers all these different sections on that.
Yeah. Thank you so much for that
Of
reading.
course, of course.
And thank you so much for taking the time out and talking about the book and your background and sharing with us.
It is
Um,
such a pleasure, Khadija. I'm such a fan of your organization. It's just an amazing, amazing work you do.
that is very kind of you to say. Thank you. Um, and if someone's interested in buying this book or getting their own copy, where's the book available?
Yeah, it's available at all major retailers, Amazon, Barnes and Nobles, and the rest. Barnes and Noble and the rest. It can all be accessed through my website, which is my whole name as one word, Amy Mendillo, AMYMENDILLO.com.
Okay, awesome. And we will have all of that linked in this video. And then thank you again, Amy. If there's anything that you could leave us with, what would you say?
Oh, I would just say thanks to this community for being so thoughtful and engaged and rigorous and fun.
Awesome. Well, thank you so much. And everyone who's watching, do definitely get your copy. Thank you again, Amy, for your time and sharing your skills and sharing your book with us. And hopefully, we will be connecting again in the future.
Yes, it's my pleasure. Thanks so much, Khadija.
Of course.